Welcome to our 1 hour with Nigerians in West Texas. We appreciate your time. We thank you for making this a date. I know it's a weekend. We have one place or the other to be. It's time for us to rest, but we chose to be here. Thank you for spending time with us. And today we have some very vital topic for every woman, basically, but the men can also hop on to hear what we have to say as women as well, or what our concerns are. So, this evening we'll be spending time with one of us, Dr. Tomilona. I'm sorry if it's Tomilona or Tomilona. Please pardon me, but we'll be spending time with Dr. Tomilona Abiodun, and she's going to be speaking with us today on a topic that is very important. The topic is That's Not Normal, 10 period warning signs. So before I give Dr. Tommy the mic, I'm just going to briefly give some house rules and introduce our speaker today. Then we'll take it from there. So this is a 1 hour session. We already had about 5 to 7 minutes going for having other people to join. And it's going to be 30 minutes for the speaker presenting to us. Then we have 30 minutes Q&A. But in a case where our speaker feels we need to go a bit further because I have so much to offer, please feel free to give us all that you have today. And also, let's keep our mics muted. That can be very distracting, please. We don't want to obstruct anyone's concentration on today's meeting. So let's keep our mics muted. When we have questions, please just throw it in the chat box. We'll get to the questions during the Q&A session. Let your questions come in. We want to engage at the end of the day. We just don't want to have doctor speak and we're like, okay, we heard you. No, that's not why we're here. This is an interactive session. So I'm just going to dive straight into introducing our speaker. Like I said, it's a pleasure to have you once again, Dr. Oluwatomilona Abiodun. She's a director in medicine, and Dr. Abiodun earned a degree in biochemistry from Baylor University and a doctor of medicine from the Mayo Clinic Alix School of Medicine in Minnesota. She currently serves as an OB Hospitalist in ORMC and is also the Texas Medical Director for Delfina Care, a technology-driven company focused on reducing maternal morbidity and mortality. So beyond clinical work, Dr. Abiodun is deeply passionate about women's health education alongside ministry with her husband. She's committed to breaking down complex medical topics into clear, practical insight through a YouTube platform, TomiTalksMed. So I would want us to check that out, please. We are truly grateful to have you here with us today, Dr. Abiodun. And I would enjoin us to please warmly welcome Dr. Oluwatomilona Abiodun as she dives into today's topic. Thank you so much, Doctor. The floor is yours.
Yes, ma'am. Good evening to everybody. Thank you for spending your weekend with us, as we said. My name is Oluwatomilona Abiodun, and I'm an OBGYN by training, which basically means that I take care of women that are in pregnancy, out of pregnancy, no matter where on their lifespan they are, I take care of women. And this, I think, is a very critical topic that has to do with a lot of women that we know, ourselves, etc. And so I think there's nobody really that this isn't for, because even if it doesn't apply to you directly, you could be able to teach someone in the future or a family member or any of those things. So with that, I will start by sharing my slides and then we'll get started. I will be periodically looking in the chat, so please drop your questions if they have to do with the slide in particular that I'm on. I'm happy to interrupt my flow with a little bit of Q&A. And then also, of course, we have designated Q&A time at the end. Can everybody hear me before I get started?
Yes, we can. I
Okay,
believe so.
beautiful.
Yeah,
And can everybody see the slides?
absolutely.
Okay, thank you, ma'am. All right, with that, we'll get started. This is, that's not normal. 10 period warning signs. All right, before we get started, though, I did want to make three disclosures. Number one, I don't have any conflicts of interest that are related to this program or presentation. Basically, I'm not getting paid for any product or anything that I'm talking about today. Nothing here is going to get me a profit. Okay. Second, the information here that we're sharing is strictly educational. I wouldn't classify it as medical advice, and it doesn't supersede what your specific OB provider has ever told you. And lastly, if you have any concerns, you always contact your physician or your OBGYN provider. And for the purposes of this discussion, OBGYN is an obstetrician and a gynecologist. The obstetrician is the person that takes care of people in pregnancy, and the gynecologist is the part that takes care of women outside of pregnancy. So just putting that out there. Okay. Our roadmap for today, we're going to be talking about what exactly normal bleeding should be. And then from that, we'll be able to talk about abnormal bleeding and what constitutes that. So, what is normal bleeding? Normal period is basically the result of the up and down of your hormones as you go through the month as a woman. It is the preparation for pregnancy that the body goes through every month in with respect mostly to the uterus. So the uterus is the house of the baby, the womb as we call it, and every month the body prepares a lining that is thick enough and nutrient dense enough to take care of a developing embryo or fetus as it continues to grow. Now, of course, we don't get pregnant every month, right? So, with the failure of implantation or conception in a month, the body realizes, hey, I don't need this anymore because the body didn't have an egg and a sperm meet. And so it tries to shed that tissue that it grew and grew and grew to embrace a baby that it doesn't need anymore. And that shedding is the process that we call a menstrual period or the actual bleeding part. Now, this is in a couple of different phases, but the things that you should know about a period is that number one, it's about 21 to 35 days. That doesn't mean that you're bleeding for 21 to 35 days. When we talk about a menstrual cycle, we start with day one, when is the first day of bleeding, all the way until the next day one, which, if that makes sense. So that duration should be about 21 to 35 days. That's why we say it comes about once a month, right? Because a month would be about 28 days or 4 weeks, plus or minus 7 days. Usually the bleeding itself should last about 5 days, give or take a few. Most people, it's within that 3 to 7 day range. You should not be bleeding between periods. And like I said, we talk about day one being the first day of bleeding. So those are the kind of cornerstone ideas surrounding a period that anybody should know and have ingrained in their mind. With that, we'll then be able to talk about what abnormal uterine bleeding is, or AUB. So anytime I say AUB from now on, I mean abnormal uterine bleeding. The 10 signs of AUB, things that you should be worried about are number one, it's too long, right? So outside of that window that we talked about. Number two, it's too heavy. Now, the body that kind of governs OBGYN's ACOG basically says that you should be bleeding about 80 cc's during a menstrual period, but nobody takes a measuring cup and puts it where their blood is coming out, right? So nobody really knows. But the point is, you're filling up pads, you're going through like a pack of pads a day, you're soaking your clothes, you're soaking your underwear. That's not normal, okay? That's what we call heavy. Bleeding between periods, that is not normal under any circumstances. And if you have that, we need to investigate. We'll talk about that later. If your bleeding is irregular, so remember I said it should roughly occur about once a month, right? Give it one or two, 1 week, 1 week before, 1 week after. So if it's not happening in that frequency, we need to talk about it. Number six, if it's too painful. What do I mean? You are missing work, missing life activities, missing school because you are so in so much pain that you cannot function. Now, with menstrual periods, you do have some degree of discomfort and pain. But if it's pain that can't be managed by Tylenol and ibuprofen, we need to talk. Number five, everything causes bleeding, not just your period. I'm talking nosebleeds, gum bleeds, bleeding at the dentist, bleeding in surgery, bleeding when you have a baby. Well, everybody bleeds when they have a baby, but I'm thinking like you're losing 1 to 2 liters of blood, right? Things like that. That's what I mean by everything causes bleeding. Number four, if you had periods that were normal and then they stopped. Number three, if you had never had periods that were normal, they never started. Number two, if you're pregnant and you're bleeding. And number one, if you're bleeding after menopause. So I just want these to be in our head for the next talk, the next section that we're going to talk about, because I'm going to try to relate all of these signs to the different diagnoses that we look at when we talk about abnormal uterine bleeding. I'm going to pause for a second and see if anyone has any questions. Nope, not yet. Okay, awesome. Let's keep going. Now, like I said, there's this board called ACOG that basically governs all OBGYNs and gives us the yardstick or the boundaries with which we practice and synthesizes all the research and information that we have about our field and puts out recommendations. And they came up with this acronym that basically describes the different diagnoses that may be associated with bleeding in their categories. They group them roughly into what we call structural and non-structural causes, meaning that structural, there is something physically that we can see that is leading to your bleeding. And non-structural means quite the opposite, right? Maybe it's a hormone or a cycle or something that's causing your bleeding, but it's not a physical thing. Okay. We're going to talk about all of these, but basically they spell palm-cohen. So if I say palm-cohen, this is what I'm talking about. Moving on, the P in palm cohen stands for polyps. Basically, these polyps are growths. I want you to just imagine like a wart that's growing in the lining of the uterus. Okay, it's on the inside of the uterus. It's a little projection. It's soft. It's fleshy, but it's just sticking out there, right? The reason this can cause abnormal uterine bleeding is because this little projection is like a finger sticking up in the uterus, and it's not this smooth lining, right? So any rubbing the wrong way, anything happens, it can get irritated and it can cause spotting. And because it's an outpouching of that endometrial lining, it can make periods that are already happening heavier. So somebody could have heavy periods or they could have spotting or bleeding between periods. And depending on where they grow, if they grow near your cervix, it can actually lead to painful sex. Now, causes of this are infection, inflammation, if you have hormone replacement therapy, basically anything like tamoxifen that increases the chance of the tissue building up can increase the chance of growing this, right? And obesity for kind of the same reasons, the hormonal changes. So this is one of the causes of abnormal uterine bleeding that could be investigated should someone show up with the signs that we talked about. And most of the time, you can diagnose this either on ultrasound or you can put a little camera in the uterus and take a look around. It's called a hysteroscopy. All right, moving on to the A in palm cohen, adenomyosis. The way to think about this is we talked about the uterus and the lining that grows in the middle, right, to prepare for baby. Now imagine if little pouches of that lining start to invade the muscle of the uterus, the meat of the uterus, and they get stuck there. So what ends up happening is now the tissue it's still lining of the uterus, it's just in the wrong place. And it's still responding to all those hormones, it's just in the wrong place, right? It can't get out. And so what happens is it starts to make the uterus grow into this kind of balloonish shape. It becomes bigger, it becomes painful because again, the tissue can't get out. And then you may have heavier bleeding because you have excess of that tissue. So again, somebody could have painful menses, heavy menses. Why this happens, we don't really know. We're still trying to figure that out. Pray for us. But it is very annoying. And really, the only cure for this is a hysterectomy because, as you imagine, aside from medications to help calm down the tissue response to hormones, as you imagine, this tissue's inside the uterus, right? It's not like in the lining where you can go take it and take it out. It's in the meat of the uterus. So either you use medication to calm down the response to hormones, or you take out the uterus. Next one is our favorite, the L in pumpkin, leiomyoma, also known as fibroids. Now, as you see, it looks like popcorn in the uterus, but it just gives you an image of the fact that these can kind of grow anywhere. It's like, it's not the lining of the tissue that's getting stuck in the uterus now, it's more like the meat of the tissue's overgrowing, if that makes sense. They can grow in different places, and the different places that they grow will tell you the different symptoms they can cause. So just like the polyp that I told you grew inside in that lining of the uterus, if a fibroid grows in the same place for the same reasons, it can cause that irritation and bleeding. Now, if a fibroid grows in the meat of the uterus, or let's say on the outside of the uterus, where it's not in contact with that lining that bleeds, then it can probably cause things like pain. It can cause this feeling of heaviness. It can make a belly look big. I remember I knew someone who had a lot of fibroids to the point where people would ask her, "How many months are you in your pregnancy?" And it was really embarrassing because her belly was so big because it was so full of fibroids. It can cause things like constipation, issues with urination, basically because it's taking the space that would automatically be taken by your intestines, your ureters, all those things, right? And so it's pressing on all of those things and creating an issue. For those reasons, depending on where the fibroid is, what the fibroid's causing will determine the management. Some of these fibroids are really tiny or they're growing in places that don't really cause any issues. We leave them alone. If it ain't broke, we don't fix it. And the fact that 99% of these are benign is that reason too. We don't go running after them. But when they start causing problems, we address them either by taking out the fibroid or by taking out the uterus. The other thing that these fibroids can cause, in addition to abnormal uterine bleeding, especially the ones that are going kind of closer to that lining, as we said, the lining is preparing for a baby, right? And so sometimes these can be a cause of infertility. And some infertility specialists will recommend a myomectomy or taking out of that specific fibroid before they do IVF. Moving on, the M in palm cohen is for malignancy or hyperplasia. Basically, this means cancer or tissue overgrowth that could possibly lead to cancer. Now, this could be cancer anywhere. Obviously, uterine cancer can cause abnormal bleeding. Cervical cancer can really cause abnormal bleeding. Ovarian cancer, certain types that are hormone regulating can also cause abnormal bleeding. Now, because they're different types of cancers, there are different causes, right? But the effects and the things that we should look out for to alert us would be somebody that's had menopause and is having any kind of bleeding, any. They need to be checked out because while it may not be cancer, right? It may. So we need to be able to do an investigation. Anyone that's having bleeding within periods, again, anything that's abnormally growing within the lining of the uterus can cause bleeding or spotting between periods. And it's not a quantity issue either. If you're having any bleeding within periods or any bleeding after menopause, it needs to be addressed. And also, of course, pelvic pain, because things that grow in the uterus abnormally will cause pain. The C in palm cohen is called coagulopathy, which basically means your bleeding system is abnormal. The thing that makes you bleed or the thing that makes you stop bleeding is messed up. These are the people that I was talking about when I said everything causes bleeding. You bleed at the dentist, you bleed at the doctors, you bleed like crazy when you have a baby. You bruise if you hit your hand the wrong way, you automatically see a bruise more than once or twice a month, sorry. Your family history is full of people that have this problem. Or you know your mom, sister, aunt that like her periods were just debilitating. She couldn't go anywhere. Or you yourself may be experiencing those things. Those are clues that maybe somebody needs to get worked up for a possible coagulopathy, meaning that they test different enzymes in your blood and in the system that makes blood clots and the system that stops bleeding to see if anything is broken and to see if there's a solution to it. So that's what a coagulopathy is. The O in palm cohen is for ovulatory dysfunction, meaning anything in that cycle that causes the preparation for a baby and the shedding of that preparation is broken. Okay. So it could be, for instance, something like PCOS, where you have chronic anovulation. What does that mean? You're basically skipping cycles and you're not ovulating. And all those eggs get stuck in the ovary and you're not basically being able to shed the tissue that's preparing for the baby. So imagine the uterus is like, I'm waiting for the egg. I'm waiting for the egg. And it never really gets the signal that like the egg is not coming. And it goes one cycle, two cycles, three cycles. And then it's like, okay, this lining is too heavy. And then it just sheds it randomly. Does that make sense? So that system of communication that says, hey, I'm bleeding, I need to stop bleeding, or the system of communication that says, there's no baby this month, we ovulated, the egg is gone, we need to shed, is broken. Now, sometimes in teenagers that have just started their periods, we expect that because the brain communication with the uterus and the ovaries is still getting itself set in order. And so for the first few years after they start their period, we expect things to be a little wonky. But we're talking about people who have had regular periods or for the longest time since they started periods have always been like that. That's a problem. You shouldn't have started your period in your teens and you're in your 30s and you're having a period maybe every 3 months, every 4 months. That's not normal. That needs to be evaluated. Other things can cause this too, because any disease theoretically that affects hormones can affect your periods, right? Things like thyroid issues, kidney issues, diabetes, endometriosis, something called primary ovarian insufficiency, which is basically where your body prematurely goes into menopause. And then also rapid weight loss. For my people who are trying to be fit and trying to get the bikini body back, I feel you, but it cannot be too quick because when you change the composition of your body and your hormones too fast, you mess up that communication channel and again can mess up your period. That's why people who have anorexia oftentimes will lose their ability to have a period with the rapid weight loss. The E in PALM-CON, I'm almost done, is endometrial. Basically, anything that has to do with the endometrium. We talked about cancer earlier, but things like atrophy, someone who's menopausal obviously doesn't have all the hormones that they need to be able to keep that lining nice and plump. And so sometimes it can be dry. And when it's dry, it gets irritated and it can cause a little spotting. That's thankfully one of the benign causes of abnormal uterine bleeding, especially bleeding after menopause, but it needs to be investigated to make sure it's not cancer, right? Additionally, infection or inflammation of the endometrium itself. So if somebody has a sexually transmitted disease like gonorrhea, chlamydia, or other different types of diseases, the irritation from that ascension of bacteria or the moving up of bacteria from the vagina into the uterus can cause bleeding. That's abnormal. Things like bleeding in between periods, abnormal discharge, those kinds of things. Additionally, pelvic or uterine procedures, though rarer now in the United States because they're performed more safely and also we give antibiotics, can also cause this, right? If somebody has a dilation and curettage, let's say they had a miscarriage or they have an issue where they need diagnosis and they have a dilation and curettage, sometimes C-sections that are performed either unsafely or the person has a high risk of infection to begin with can cause this too. The consequences of this, if you have endometrial issues, may be infertility, pelvic infection, sepsis, which is basically a deadly form of infection. But again, we're talking about abnormal uterine bleeding, and that could be one of the causes as well. Iatrogenic. This means we did it. Basically, anything in the medical system that causes you to bleed abnormally is iatrogenic. What do I mean? Let's say you just had a baby and you want to do family planning and you choose either birth control pills or you choose an IUD that has a hormone or you choose a Nexplanon that goes in your arm or any of these hormonal contraceptions. The first kind of couple of months of using it, the body's still trying to establish a new baseline of your hormone levels between the medication, the implant, whatever, and you. It doesn't mean these are bad. It just means that, just like when I said that children who are starting their periods, the body's still trying to get in order. And so we expect that communication to be wonky and the bleeding to be irregular. The same thing applies here. It's essentially trying to reset itself, and the bleeding can be irregular for the same reasons. Another thing is that medications like blood thinners can also cause this. For instance, if you had normal periods before and for any reason you have to be on a blood thinner, the thinner your blood is, the faster it flows. And so someone who previously had normal periods can have heavier periods because now they're on something that provokes that. Or someone who's on a medication like tamoxifen for breast cancer treatment and prevention can cause the same thing because it kind of promotes that growth of that lining. Like we talked about surgical injury or even surgical procedures like C-sections, D&Cs, even normal childbirth. If there's an infection or there's an issue with the actual lining of the uterus after childbirth can cause this too. And then the last category is not yet classified. I stick my favorite things in here because I love OB and I love pregnancy, but pregnancy, right? So if you have normal menses and then your periods stop, go take a pregnancy test, please, because it could be that you're pregnant. And that's an obvious form of abnormal uterine bleeding, but it's one that must be mentioned. Bleeding in pregnancy, right? You are pregnant theoretically, so you should not have periods. So if you're bleeding for any reason, it needs to be investigated. Now, there are a litany of reasons why someone could be bleeding in pregnancy, and I won't bore you with those unless someone asks a question. But that's also another reason. Something called an AVM or arteriovenous malformation, basically an artery and a vein decide to meet and outgrow themselves, and they start being provoked and causing abnormal bleeding in the uterus. I've seen, I think, two cases of that in so far in practice. And then lastly, cesarean scar defect. So let's say you had a C-section before, and for some reason that scar is kind of wearing down. The irritation of that area can cause abnormal bleeding as well. That's not all that belongs in this category. These are just a few examples, but I wanted to make sure that I told you about kind of the limits that this could go. So again, kind of recapping after talking about all those different diagnosis categories and talking about the 10 signs of AUB. Ooh, did I go back? I went back. Okay. Talking about the 10 signs of AUB, remember if it's too long, if it's too heavy, if you're bleeding between periods, if your periods are irregular, if they're too painful, if you're having everything cause bleeding, if your periods stopped, when they were normal before, or you haven't gotten your period for like adolescence. If a girl hasn't gotten her period by like age 15, you're pregnant and you're bleeding, and again, bleeding after menopause. So those are the main categories of abnormal uterine bleeding. And if you have any extra questions that may not be answered in this 1 hour program, please feel free to text me. That's my number. I do confidential paid consultations on the side. But yeah, thank you for your time. Thank you for listening. And I hope that this taught you something that you'll be able to pass on to someone in your family or even use for yourself. And with that, I'll end my presentation. These are my references. Thank you all.
Wow. That was pretty um interesting, and you were able to wrap it all up in a short time.
I was
I
trying to
wasn't
be time conscious.
I know I wasn't expecting that, but thank you. But I think we got so much. Please, let's get our questions coming in. Thank you so much, Dr.
No
Tomilono
problem.
Abiodun.
No problem at all.
We appreciate you. We appreciate your time. There was so much you gave us in a short time. And we believe the questions would help you elaborate on some other areas you were not able to touch. I have a question, but I would see
Yes,
if
ma'am.
anyone, if you have a question, you want to unmute to ask your question, or you want to drop it in the chat, please feel free. We still have time, please. Any question, concerns, anything that was missing that you were expecting to hear, or an addition or something?
And I know there are a couple of doctors on here, so please correct me if I missed something.
Okay, someone have a comment for us, I believe. Okay,
Yes,
can
sir.
you please unmute Dr.
Dr.
Enapano?
Nafane.
Yeah.
Hello, everybody. Good evening.
Good evening.
How are you, Dr. Abiodun
Fine, sir.
Tomilano? I mean, that was a very wonderful and fantastic presentation. You touch base with every point in a very, very short period of time. So, I mean, all the things you said are all appropriate and correct. So, just a brief comment that your menstrual period is a window into your physical, mental, and emotional health. So at times, when you are having an abnormal bleeding, it may point to something is going on in your body, and you really need to go for an evaluation so that to see what is causing this bleeding or what is going on. For instance, some women, when they are going through emotional distress, maybe they lost somebody and they may not even see their period at all. So, of course, as Dr. Abiodun said, you still have to find out whether you are pregnant if you are sexually active, so that you won't blame that because of your emotion, that is why your period disappear. So, is yeah. So, yeah. So, I personally deal with a lot of women who are pregnant. That's my field. If I'm a maternal fetal medicine physician, I'm a high risk doctor. I tell my resident, any bleeding in pregnancy is an abnormal.
Yes,
Never. There is no normal bleeding in pregnancy.
correct.
I have heard people saying that, oh, I bled throughout my pregnancy. That is bullshit. I'm sorry to use that word. That is an abnormal. You need to go for investigation. So I just want to put it out there. If you are having any bleeding in pregnancy, he needs to be investigated. Don't assume that, oh, this is normal. This is not normal. Thank you so much once again for your presentation.
Absolutely, sir. And I agree 100%. Similarly to when we were talking about people who lose weight really rapidly, people who are grieving, people who are stressed, and for instance, your eating habits change, you start to lose weight, you notice all of those things, or there's an underlying disease or issue that causes those things too. You'll see the manifestation physically. And so it is important to take that seriously. While we hope and pray that everything is benign, we always want to make sure there's nothing else that's going on. So once we rule out those things, then we can come back and say, okay, how do we manage stress? How do we manage anxiety? How do we manage eating habits and things like that? 100% agree. Thank you, sir. I
Thank you.
see a question in the chat.
Yes,
It
would you want me
says,
to read that to you, or you got it?
I can read it, it's fine.
Okay.
It says, is it normal for symptoms to change as women get older, even without any underlying condition? Absolutely. So there is a window that's called perimenopause. And this is kind of the oddball time where your body's kind of signaling that, hey, I'm winding down. The hormones, that are causing these periods, we're kind of getting into that menopausal phase. But you're not quite there yet. And so what ends up happening is as these hormones wind down, your periods may get longer, farther apart, right? They may get less. And sometimes because of this, your periods will become more irregular than you're used to. And so, again, like I said, as you're getting older, it's important to be able to go get investigated and make sure none of the other scary bad things that we talked about are happening. And then we can say, okay, with a good amount of confidence that, okay, you're in your 40s, you're getting closer to 50s. By the way, the average age of menopause is 51. So if you're around that age, you can say, okay, maybe I'm in perimenopause and that's why these things are happening. But the guessing is the thing that we want to counsel against, right? Don't assume that that's what's going on. If it's abnormal, we need to investigate it. I hope that answers your question. The next one says, question. For older females who haven't seen their periods for 4 months, does that mean this individual has started menopause? Possibly. So the definition of menopause is really a whole calendar year. But if you haven't seen your period for 4 months and you took a pregnancy test and you're not pregnant, this possibly means that you're in perimenopause. Yes, more likely than not if you're not already in menopause. But you can't really define menopause until you've been out of that window for a year. That's why we always say take a pregnancy test. I have seen people in their 40s and their 50s who thought, I'm in menopause. No, they were pregnant and they had no idea because they didn't take a pregnancy test because they thought that they were in menopause. So we always, always, always say take a pregnancy test. Any other questions?
Okay, while we wait for another question, I have a question.
Yes, ma'am.
Okay, can birth control, contraceptive, whatever, marks the signs of serious whatever, like period warning signs? Like some women would actually stop menstruating or having their cycle when they have certain, what's it called,
Birth control.
contraceptive or birth control. And the doctor says that's fine, or some
Mhm.
doctor says that's fine. So I wonder,
Mhm.
what do you have to say to that exactly?
That's an excellent question, and it is absolutely true. So again, let me give you an example. I'll use the hormonal IUD. Okay, that's a common one that does this. So some people, when the IUD is in their body, it releases a certain amount of progesterone over time. Okay, that hormone essentially stabilizes the lining of the uterus. Remember what I said? Your menstrual period is essentially your body thickening this mucus and not mucus, sorry, the endometrial lining to get ready for a baby, right? The job of the IUD is to keep that lining thin. Okay? In addition to the response to your own hormones that are going up and down every month, you now have a device that's keeping the lining of the uterus thin so it does not develop the environment that is suitable for pregnancy. Does that make sense? That's how this functions long term to be a birth control. Now, let's think about it. If this thing keeps your lining thin, that means the thing that is developing that you would normally shed to bleed is gone. Which is why, depending on your hormonal cycle and how much hormone your body can tell your uterus to make some of that lining, that means that for some people, the amount of the progesterone that's thinning out the lining overrides the amount of the hormone that's telling it to grow, which means that there's nothing to shed. So it's not that your IUD or your hormonal device is really messing up your periods. It's not messing with it at all. It's acting locally to remove the thing that you would shed every month, which is why some people can actually become anovulatory, or sorry, without amenorrheic is the right word, not anovulatory, meaning that you don't have a period. It doesn't mean you're anovulatory, meaning you don't ovulate. It means when you ovulate, there's no response in the uterus because that device is keeping the uterine lining thin. So there's nothing to bleed out. Does that make sense what I'm trying to say?
Sure, that makes sense.
Yes. So that's why it's not a bad thing. And we actually expect it if you are on certain types of birth controls that you may stop your period altogether. You're not abnormal. Nothing's wrong with you. Your body's actually responding well to the medication that you're being given.
Okay. I think we
Yes,
have a
ma'am.
question in the chat.
Okay. Let's see. Is a hysterectomy always necessary, especially when the pathology results most often show normal findings? Well, that's a great question. So, normal findings doesn't always mean there's nothing wrong. Let me explain. Someone can have a fibroid, right, the size of Texas. The fibroid itself is not cancer, it is benign. So when you get the pathology results, you'll see leiomyoma, no signs of malignancy, yada, 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 right? But if the fibroid was so big that your belly looked like you were 9 months pregnant and you were starting to have issues passing poop because it was constipating and pressing on your colon, and you couldn't pee well because it was pressing on your ureters, right? This becomes a big problem. While the tumor, the mass, is benign, it is causing very not benign problems. And so for some people like that, a hysterectomy is necessary. I'll give you another example. Let's say your uterus fibroid is not the size of Texas, but it's growing in a place. Remember, I told you if it's growing on the inside in that lining, it can cause bleeding, right? So if it's growing in that place and you're bleeding through 2 packs, I'm not talking about pads, 2 packs of pads every day, and every time you have a period, you have to get a blood transfusion, a hysterectomy might be necessary to save your life. Is the fibroid cancer? No. Is the disease that it's causing probably going to take life? Maybe, right? And so a hysterectomy may be necessary for non-cancerous reasons because the problems they're causing are so debilitating, taking out the uterus is the only solution. Somebody like that has adenomyosis. Remember I said that, right? Adenomyosis is that tissue in the lining that's now stuck in the walls and causing all this pain. You can't live your life if you're in severe pain. Again, if you're soaking pads every day and you have to have a blood transfusion every month, I've seen people like that. And talking to them, I'm like, this is not how to live. You're not supposed to be living like this. And you realize that the hysterectomy, when they have it, it's night and day. It's like somebody gave them their life back. They're no longer working on a hemoglobin of 3. They have a hemoglobin of 12 or 13. And so when you see that the life-changing status of having a hysterectomy actually outweighs the risk. Now, obviously, if you want to have children or something like that, that's a discussion that needs to be made. But when we're talking about the hysterectomy and the role of it itself, it's not always for cancer. Another reason I'll give just very quickly, somebody who has a baby, right? Because not only for fibroids, someone who has a baby, just had a baby, and Dr. Nakwane will know more about this too, because we were talking about it a while back. Someone has a baby and they're bleeding. They're losing 3 liters, 4 liters. We are transfusing them and we can't keep up with the blood that they're losing. To save their life in that moment, they may need a hysterectomy, even though they just had a C-section, or even if they just had a vaginal delivery. Now, if you look at the uterus that was taken out, it's normal. But because of reasons that we can't get into here, they had a high risk of bleeding and they bled so much we couldn't stop the bleeding safely. And so to save their life in that moment, we had to take out their uterus. Is the uterus cancer? No. But is the situation dire? Yes. I hope that answers your question.
I want to believe so.
Okay. Oh, there's another one. Can a pelvic
Yeah.
surgery such as a bilateral salpingectomy cause AUB? This is my favorite question ever because it allows me to talk about anatomy. Let me see if I can find that picture. Hold on 1 second. Let me go back and see if it showed it to me here. Okay. I'm going to share something real quick. Just give me 2 seconds because then it'll allow me to talk about it. Where is it? Okay. Can everybody see my screen? We're going to talk about anatomy for a second. So
Yes.
imagine that these popcorn fibroids are not here, okay? When we're talking about a bilateral salpingectomy, basically the new version of tying your tubes, which is basically taking your tubes out. You don't want to have babies anymore. You don't want to use birth control. You take your tubes out, okay? What a bilateral salpingectomy is you see this right here. Can you see my mouse? Okay, so you see this right here, that's the fallopian tube, okay? You see this right here, that's the fallopian tube. This is the ovary, where all the eggs are that become babies when they meet the sperm. This is an ovary. This is the uterus. So basically, whenever we have sex, an egg travels here, you ovulate, right? You release the egg. It travels, travels, travels. It meets the sperm somewhere about here. And they travel together and implant on the uterus and become a pregnancy and a baby, okay? Let's understand that. The hormones that regulate your periods are produced here, where the eggs are, in the ovary. The baby stays here in the uterus. The menstrual cycle, the response to all those hormones happens here in the uterus. The lining is here in the uterus. The only job of these tubes right here, this one right here, and this one right here, is to carry the egg from here to here. That's the only function of the fallopian tubes. They are the bridge between the ovary and the uterus. They allow the egg to travel and implant and become a baby, okay? If we take out this tube, that's a salpingectomy, removal of the fallopian tube. If we take out this tube, there is now no connection between the ovary and the uterus, meaning you can't get pregnant because there's nowhere for the sperm to meet the egg. It's stuck. It can't get out, it can't get into the uterus. Does that make sense? Why am I going through all this detail? If we're talking about abnormal uterine bleeding, it is the response of the uterus, the lining of the uterus, to the hormones produced in the ovary and in the brain. It has nothing to do with the tubes. So taking out the tubes, this is why somebody whose tubes are gone or they tie their tubes doesn't stop having periods. It's because the hormones are still being produced by the ovary, the uterus is still responding to them, the tubes just take out the pregnancy part. That's why a salpingectomy, to answer that question, cannot cause AUB. Now, if you had a salpingectomy and they didn't do it right and there's bleeding, very different bleeding, but this not has nothing to do with AUB. Now, the only way to stop AUB permanently, aside from menopause and medications, is to take out the uterus. When you take out the uterus, with or without the ovaries, that means you are losing the thing that's responding to the hormones and causing the menstrual period. Does that make sense? When you do a hysterectomy, you take out the uterus, you stop the period, you stop the bleeding, you stop the AUB. That solves the problem. When you take out the tubes, all you are preventing is pregnancy. I hope that answers the question.
I believe so. We have another one.
Okay, for someone with regular cycles, what signs usually tell you the hormones are doing what they should? The fact that you have regular cycles. If you are bleeding regularly every month, your hormones are doing fine. That's it. That's it. Sometimes people come into clinic, I want my hormones checked. I mean, you can, but the fact that you are bleeding at the same time every month and your cycles are predictable means your brain is talking to your ovaries, which is talking to your uterus. Everything is working as it should. I hope that answers your question.
Okay. I believe so too.
Okay.
Okay.
Any other questions? I hope this is helping. I'm trying to be as time conscious as possible when answering these questions
Well, we
while
still
being
have
thorough.
about 15 minutes to go. So if you have
Oh,
something
great.
else to
Okay.
share,
Excellent. Excellent.
please feel free.
Excellent.
Yeah,
Can you
okay.
still be pregnant with one fallopian tube? Yes. Oh man, let me go back and share that screen. Let's go back. Okay. You can still be pregnant with one fallopian tube. Now, let's go back to our screen. We have two fallopian tubes. We have two ovaries, right? In reality, even though the uterus is like laid out like this, like you see it right here on this picture, in reality, that tube is kind of doing this thing. Okay? It's like waving around, saying hi to everybody. So if I take out one tube, right, this tube is still here and waving around. And in fact, studies have shown that you can ovulate from this ovary, even though this tube is gone, and still get pregnant in this tube. So the fallopian tube is kind of waving in the back, waving to the right, waving to the left. Whichever one it catches is catching them all and is catching all the eggs and bringing them into the uterus. So absolutely. If you have one tube, let's say somebody had an ectopic pregnancy, for instance, right? And they had to take away one tube, you can absolutely still get pregnant with the other two. I hope that answers the question.
Okay. I think that does. So, another quick question. I know
Yes,
people
ma'am.
say things about what you eat during your cycle can affect the flow, the pain, whatever comes with it. Can you speak on that a bit? Food to avoid
Well,
or what to?
yeah, yeah. You know, the thing about cycles is that most of them are inflammatory responses. Like, for instance, some people have pain because of inflammation when it comes to a cycle. That's why we recommend things like ibuprofen and Tylenol for people with severe pain in their periods. Actually, starting ibuprofen and Tylenol right before your period and continuing it cyclically throughout your period to help with pain. Now, obviously, some of the foods that we have anti-inflammatory properties. And for that reason, they may also contribute to lessen the pain and discomfort of periods too. Does that make sense? Yeah. Okay.
We
I
have more
see a
questions. Two
and
questions just dropped. Yep.
okay. Does hormone imbalance cause an infection such as a yeast infection? Not hormone imbalance, but more environmental microbiome imbalance. I don't know how to put that. Yes, let's do that. Just like you have your gut microbiome, there are bacteria that typically live in harmony and community in the vagina. I know that's weird to think about, but there's good bacteria too. They're doing their job. They're fine. They're keeping the peace. Okay. Now, if there's an imbalance of those, let's say you have a strep throat, you have a pneumonia or something, and you take a bunch of antibiotics. And those antibiotics are not just killing the pneumonia or not just killing the strep throat, right? They're working in your body, so they're killing bacteria everywhere. So then imagine the harmony has been happening between these bacteria and they're doing just fine and everything's good in the vagina. And then this antibiotic comes and kills half of them. Okay. Now you have an overgrowth of bacteria, and this can cause something like bacterial vaginosis. You also have an overgrowth of yeast, which can cause yeast infection or vaginal candidiasis. So it's not really the hormones that are changing, it's the bacterial environment in the vagina that's changing for one reason or the other. Let's say antibiotics, or people like to douche or wash inside the vagina, which we don't recommend for this very reason, because you're washing things away that should be there. The vagina cleans itself. It is just fine. You don't need to wash on the inside, just the outside. You washing on the inside can change the environment of your vagina unnaturally and then can cause things like yeast infection and BV. Okay, next question. After checking my hormones and receiving a report that they are fine, I am still missing periods for months, then regular for months. What can be the cause? This is an excellent question. So your hormones are okay. So the quantities of those hormones are good. Now we're talking about the regulation. So sometimes remember, I talked about this HPA axis. So the hormones are there, but they're just not talking to each other correctly, and they need to be regularized. Some people need birth control for this reason. So it's not birth control pills for birth control. They're taking it for the regularity of the hormones, so that way their hormones can be at the right level every month to produce a monthly period. And that's why some people who have abnormal periods, teenagers at the beginning of their menstrual cycle, or people that have issues with their periods later on, will be put on birth control so that it can actually help regulate their cycles for them. Um, the other thing that we can talk about is what Dr. Napane was talking about. What is your stress level? How are your eating habits? What is your weight fluctuation? Are there any other hormones that could be causing this, like thyroid hormones? How is your kidney function? So now we need to broaden our differential or expand our list of things that could be contributing to the abnormal bleeding. And that requires a thorough workup. I hope that answers the question. Okay. Can you say that sugar cravings during cycles is normal? I cannot say that confidently, because even the pregnancy cravings, sometimes when I was pregnant, I use that as an excuse so much. I can't say 100% are normal. But I will say that, sometimes because of the bleeding and the anemia that results from it, some people bleed so much that they develop what is called pica, which is an abnormal craving for things that have this metallic-y or rough feeling. Some people eat ice, some people eat paper, some people go for metal, different things like that. That I have seen because of severe anemia in pregnancy and during menstrual cycles. So that I think is the only dietary thing I can say with confidence happens possibly during a period. The sugar, I don't know. But if we're gonna blame the periods, blame the periods. I'm not faulting you. Any other questions?
Okay. We
And
still
if
have
anybody
eight
wants to say any
minutes.
questions, please feel free.
Okay. Okay. I guess we exhausted you enough. Maybe if we want to reach out, anyone wants to reach out to you, can you please give us the details again on the screen so we
Yes,
can
ma'am.
take that for those of
Let
us
me
that join in
share.
late?
I will do that right now.
Okay, thank you.
Where'd it go? There we go.
Okay,
So
so
yeah, please take a
please
picture. I'll
let's take a
type it in the
picture
chat as
and
well.
yeah, we can always reach out to Dr. Abiodun. She obviously she has so much to share with us, but time would not permit us, and I believe some of us still have questions that could still pop later from
Yeah.
further experience. Okay, we got a question quickly. Can what we eat
Okay.
actually make period better or worse? I think we touched on that earlier, so
Yes. Yes, we were talking about that earlier.
yeah.
So when we talk about increasing or decreasing the inflammation surrounding your menstrual cycle, yes, what you eat can definitely have an impact. I 100% agree.
Okay. In the absence of no question, in 1, 2, 3. Okay, I guess we are all good for today. Thank you all so much. And we really want to appreciate you, Dr. Abiodun. Please, guys, let's say thank you to Dr. Abiodun for our time. This was such an insightful and impactful session. We appreciate you. Thank you for spending your 1 hour with us. You came in earlier than most of us, and you're ready to stay back from all indications. So thank you for your time. We thank you for all that you
Absolutely.
shared with us, and we look forward to having you again, actually. It's always a
Thank you
pleasure
all for
to have you.
coming. Thank you for
Thank you.
listening. I
And
appreciate your time.
you're welcome. It's a pleasure. And thank you, everyone, for also joining. For those of us that joined earlier, joined later, and those that invited people, thank you. We appreciate you for engaging Dr. Abiodun today. It's such a pleasure. Okay, in the absence of no comments, no question, we might be leaving earlier than normal today, which is fine. Thank you, everyone, and happy holidays. Do enjoy the rest of your weekend, and bye-bye.